Let's Talk About Pain, a podcast from the Quebec Pain Research Network. In each episode, we discuss the latest advances in pain research with guests from across Quebec in the health and research communities. Enjoy your listening. All right, so welcome back to the second part of the podcast. And we have a really interesting second part where we're going to be talking to Rachael Bull, who's a survivor of childhood cancer, living with chronic pain, and actually currently doing her master's in Canterbury, England. So we're really happy to have her, especially across seas. So thank you for coming, Rachael. How are you doing today?
I'm great. Thank you so much for having me.
No, thank you for joining us. We've all been really excited about this. So before we get into it, the first thing I just want you to tell me, can you just introduce yourself a little bit more? Maybe just some fun facts. Maybe tell us what you're doing for your master's. Just anything really.
Yeah, for sure. So currently I'm doing my master's degree in forensic osteology, field recovery methods. And for those of you who do not know what that is, if you've ever seen bones, that's what I do. um, and I was diagnosed with cancer when I was 6 years old. I am now 25 years old.
So there's been a lot between then and now, obviously, and we have a lot of stuff to talk about. So yeah, I just wanted to preface too, for all the listeners wondering. So Rachael is from Toronto, Canada. So Rachael, the next question that I sort of want to ask you, you talked a little bit, just now, but can you tell us really about your story, with cancer and sort of your story with pain? How did that sort of evolve over the years and to where you're at right now?
For sure. It's a long, complex story. So we will kind of condense that down,
For
give you
sure.
the brief of it. So I was diagnosed with cancer when in 2004, July 2004, so 18-ish years ago now. Um, I went into emerge with a horrible stomach ache, and this is the beginning of, "Oh, you've got pain? That's cool." But so I went into hospital, this terrible stomach ache. I'm 6 years old. The doctor comes in to see me and he says to my parents, "You know what? 6-year-olds have stomach aches. It might be her appendix. Probably not that big a deal." And they're like, "Can you do a scan?" My parents really pushed for an ultrasound, something. And he said to their face, "I'm not gonna do a scan because I'm not gonna read it. I know what it is. She's got a thing with her appendix. She'll be fine. It's not appendicitis. She doesn't need surgery. We're gonna send you home. You're fine."
Wow. Wow.
Mistake number one. So, because of that mistake, around 3 months later, so this is now July, I go in for emergency surgery. I'm brought into the hospital. They're like, "We're gonna operate right now because there is something wrong." And so when they get in there, they see that I have a tumor the size of a grapefruit in this tiny little 6-year-old body, that's essentially ruptured. So when a tumor ruptures, it's basically just spilling cancer across your entire abdomen. And so because of that original mistake, they now think further down the line that I wouldn't have ended up needing radiation therapy had that been caught when it was. So because of that, I ended up needing the full chemo, total abdominal radiation. I couldn't even have the targeted because of this rupture. So I was brought to Sick Kids for my treatment. Wonderful, wonderful hospital, wonderful people, wonderful doctors. I had about a year of chemo. I had 12 straight intensive days of total abdominal radiation. So 12 of probably the worst days of my life. Um, And further down the line, I started developing back pain originally, when I was probably 10 years old, maybe even a little earlier. So this is about 4 years out, maybe 3 years after chemo, after radiation. I'm like, okay, I really have a lot of back pain. 10-year-old should not have this much back pain. Um, and then it kind of developed more into, okay, now I have more like joint pain, and that was all of this was kind of brushed off as, okay, you're still obviously growing. These are growing pains. It happens. You're 10, right? And so nothing was really done much with that. In the meantime, I was diagnosed with chronic kidney disease later, and that's also a result of chemo radiation. And so they're like, "Oh, maybe your back pain is like, oh, kidney disease." Um, I ended up having to have surgery. Um, Side note into that, another pain thing is that they insisted for the surgery that I have the lumbar epidural. Yes, there it is. Epidural. And so I really didn't want that because what 12-year-old wants a giant needle in their back? I was like, "No way." They convinced me to get the epidural, and when I came out of surgery, I was like, "Okay, I'm in pain, what?" And it turned out they numbed the wrong side. They were like, "Oh, whoops, the epidural went in wrong, and we actually numbed the wrong side." And I was like, "Awesome. Thank you for that." And so they put me on a morphine pump, and I was in hospital for a week, and I'm, like, just pumping morphine through, and they're supposed to put on a timer so that, like, you don't overdose yourself, but it makes you so sick. I was just throwing up constantly because I'm in constant pain, I can't move. I've got a morphine drip that's constantly going, and they're all like, "Well, okay. I mean, if you need it, you need it, or you could just stop." And I was like, "Are you gonna give me another pain option or just telling me to stop using the morphine?" So, that was another fun moment. Um, and then over time, I guess I just developed more pain in my back is probably the biggest one, and then I've got the joints, and then when I was about 18, I started developing migraines as well, and those are quite debilitating, as anybody with migraines would know, and so it was around maybe when I was 16, 17 that I was referred to a pain clinic. Through Sick Kids, they referred me to their joint pain clinic. Um, and so I got the referral and I went to the pain clinic and I was like, awesome, somebody's doing something about this pain that clearly isn't normal. It's not growth pains, it's something's wrong. So you get to the pain clinic and they make you fill out this really, really long questionnaire. And it's got everything from like your day to day to like how much pain have you had in this week. And then suddenly it's questions like, did you star in a TV show last week? Or have you spoken to a celebrity on the phone yesterday? And I get to these questions and I'm like, this feels like a joke. And I'm like, obviously they're there for a reason. I guess they're doing a psychiatric evaluation essentially. But I'm reading these questions and I'm like, they're just getting stranger and stranger. And I'm like, this this feels almost demeaning. I'm like, what what? And even if I had a psychiatric condition, are you now gonna go, "Oh, your pain is not real, your pain is not valid?" So, that whole questionnaire really threw me from the beginning. I was like, "Okay, sure." And then when you go into the clinic, you meet with 5 doctors. It's like this horrible, like, panel of you feel like you're being interviewed, it's terrible. And you've got a psychiatrist, a psychologist, I think a GP, a rheumatoid arthritis doctor, and someone else, I can't remember what the lineup was. And they're just firing questions at you, like, back and forth, and then they do an assessment, and they're, like, poking your back and, like, look at, your MRIs, and they're like, "Nothing shows up on your MRI." And I was like, "Nope, I don't know what to tell you, it doesn't."
And so were they all in that same room, just sort of, prodding you that whole time? That's
Mhm.
that's terrible.
Yeah.
Yeah.
It's it was not very
Yeah.
nice. Um, and then the final question they start getting into is, "Well, when I touch you, it doesn't seem to hurt." And I'm like, "Well, when you poke me, it doesn't hurt. When I walk around, I have back pain." And they're like, "Right? Okay." And then he finishes with, Do you have any after school activities?" And I was like, "Yeah, I play field hockey, I dance, I do this." And he's like, "Right, okay. Do you have friends?" And I'm like, "Do I have friends? Like, what?" And the consensus at the end was that it was psychosomatic, and I was furious, and my parents were furious because 'cause I'm like, "What?" Spend a day with me and you'll see, like, I can't walk anywhere because I need to take a seat every 15 minutes because my back is in such pain. And so that was my pediatric pain experience at the clinic there.
Wow. And so, Rachel, when you had that clinic visit, like you had that initial appointment, what was that it? Did they give you anything else? Any follow-up appointments? You know, what was that just sort of the bulk of it?
So, prior to that appointment, I had one appointment with a rheumatoid arthritis specialist, and he goes, I meet with him once, I've had a random blood work, and he's like, "You don't have lupus." And I'm like, "Awesome. What do I have then?" He's like, "I don't know. Your blood work's fine." And I was like, "Okay, where are we going from there?" He's like, "I don't know. Your scans are clean, your blood work's clean." I was like, "Okay." And that was it. And then they were like, "Oh, maybe we'll send her to the pain clinic and see." And then s psychosomatic.
Right. Right. Again, that must be incredibly frustrating to go through all that and just all as well as all the prior experiences of,
Mhm.
maybe sometimes people missing something from not taking things seriously or, what your pain could be or not checking things out. So I can only imagine
Yeah.
how tough that would be. So again, thank you for sharing that information with us. I know it can be quite a bit. Rachel, in terms of the next question, so again, it seems like when you're in the pediatric setting, you had a follow up, may not have been sort of, the greatest care that you received. What happened as you sort of transitioned to adult care?
So, being in the oncology unit, so the type of cancer that I had was called rhabdomyosarcoma, and it's relatively rarely seen in children my age at the time as well as in the abdomen. So it was like from the get-go, it was already complex, it was complicated, the care plan became complicated. So I was really well followed for all those years at Sick Kids. I had an amazing oncologist. She got everything done. Every referral went through, everything I needed. Awesome. In my last year at Sick Kids, she retired, and there was like a transition to a temporary oncologist at the time who was also in the unit. And it was kind of an awkward transition because I didn't really know him. He didn't know me. What he knows is what he reads in my massive medical record. And I saw him only once before I transitioned over, and he's like, basically, okay, you're going over to Princess Margaret. And I'm like, awesome. To see who? To do what? And he's like, we're sending you over to a radiologist. I was like, why is a radiologist doing my follow up care? It's like, well, originally did your radiation treatment, so we think he should follow you. And I was like, you know what? Sure, why not? So a transition over into adult care. I'm over now at Princess Margaret Hospital, in Toronto, and I got my first appointment with the radiologist, and he's like, the first thing he says is, "Why are you here?" And I said, "'Cause I was referred here." I'm like, "You tell me why I'm here." And he's like, "Well, I mean, I'm an oncology radiologist, but I'm not oncology." And I was like, "Okay, good chat, thank you." So he said, "Yeah, I don't need to see you anymore." And I said, "Okay, okay." So I didn't see him again, and
Right.
in the meantime, I'm kind of fluctuating between, like, I've got the kidney condition, so I had a nephrologist that I was seeing.
So did they
In the
refer you
meantime, that's
to for sorry, cut you off, but just they referred you to
no
like
worries.
with the kidney stuff that had been going on. Did they refer you as well to adult care with the kidney stuff as well? Or were you still being seen at Sick Kids for the kidney stuff at that time?
I never saw a proper nephrologist at Sick Kids actually after the
Wow,
surgery.
okay. So it wasn't only until you got to adult care that you saw a nephrologist.
To adult, I saw a nephrologist. The issue with the nephrology department at Sick Kids is they at the time, I don't know if this is still the case, they were on a rotating kinda thing, so you never saw the same person twice, and that wasn't really conducive for chronic care management. So, my oncologist at the time took that on as well and kinda did the scans and whatever I needed at the time, but I wasn't actually referred to the nephrologist until I got to PMH, had another doctor at PMH refer me, which ended up at Toronto General. That's another hospital on the list. In the meantime, I was referred to the radiologist and I was referred to a geneticist. So I was diagnosed when I was about 18 with a condition called Dicer 1 syndrome, which is a genetic condition that predisposes you to certain types of cancer, one of which is the rhabdo that I had, as well as kidney tumors and thyroid tumors. So subsequently, I ended up with the kidney disease. I also about 3 years ago, had to have my thyroid removed as well.
Okay. Wow.
So, the geneticist basically took on all of my care, and he became my point of care, for everything else, for any other referral I needed, because I didn't have an oncologist. I have to this day never seen an oncologist since because that just never came through. They were like, "You're not on active treatment," so there's this gap in adult care where if you're not on active treatment, they're like, "Why are you here?" Even though I still need that continuation of care, I still need that follow-up, I'm still a high risk individual, but there's still no continuation there.
Wow. And then Rachel too. So you mentioned sort of genetics being your primary care point. Is sort of genetics the people that are sort of scheduling like maybe your repeated scans, new scans? Is that who's doing all those referrals?
Yes,
Okay,
he is doing
wow.
all those referrals.
So
Yep.
do they have and too like in the adult center there, do they have any type of like specific clinic for childhood cancer survivors or survivors of cancer?
I think somewhere down the line, someone mentioned there was such a thing, but I was never referred there. There was supposedly a night for, um, sick kids patients who were transitioning to kind of have a debrief and an introduction to the hospital. No one ever told I found about that 2 years after I was into Princess Margaret. I was like, "That would have been really useful."
Right. Okay. Okay. So Rachel, again, a lot of stuff that's been going on. Um, the one question I have in terms of if we're taking things back to sort of your pain, what type of pain care do you think, mentioned that your pain care right now seems to be lacking, sort of from what you've explained. What type of pain care would you like to receive? Like, what do you think would be helpful at the present moment?
I think for starters is getting the proper referrals through to people who can help with that. So, I was referred to a neurologist for migraines and never came through. I called the neurology office, they'd never heard of me, and that alone is very frustrating. I think the biggest thing in adult care is the lack of follow-up. And especially also I find with pain care is that when you say to a doctor, "I've got this pain, I've got that pain," they go, "Okay," and they write it down in your record, but that's it. It's a lot of writing stuff down and, "Oh, writing that down again," but I'm like, when are you doing something about this? Like, when can I receive some actual treatment for this besides telling me to take Tylenol when I have
Right.
some pain?
Right. Yeah. Again, I can't imagine how incredibly frustrating that would be. especially not to have those follow-ups, referrals sort again followed up. So Rachel, again, we've hit on a lot of good things so far. We're just going to do one question, last question, just to sort of wrap up this segment. And then in our third part of the episode, we'll be talking to Dr. Alberts and Rachel together. But Rachel, sort of thinking, and this will sort of, be a theme in sort of our last segment. What do you think researchers can do, or what's your suggestion in terms of research, or what do you think research can do or help bring to the table?
I think the biggest thing for research is to involve patients, like Nicole has done with her clinic here, is to involve people who live with this so that we can understand it. It's something very different to learn about pain as opposed to live with pain. And so I think involving patients, understanding what pain care means, understanding what it means to live with pain and how that affects your day-to-day life is really important in the research.
For sure. I think that's a great note to sort of leave this part off. So we're going to take a quick break, and then we'll see you in the third part and the last part of today's episode. Thank you for listening to Let's Talk About Pain. Don't hesitate to subscribe so you don't miss an episode, and to share the podcast with your friends. For more information, visit our website at QPRN.ca or our YouTube channel by searching Quebec Pain Research Network. See you next time.